So I'm going to be using this talk to combine two different topics, NLP and hypnosis. Now, both are taught differently in their own rights and separately, but when the two are combined, results tend to be amazing, effectively combining the power of language and the magic of the mind. Now, let's start with hypnosis, which has been around for well over 5,000 years. Hypnosis is often shrouded in misconceptions and myths, and often only because of people's experience of what they see on TV or at these stage hypnosis shows. But hypnosis is simply a state of focused attention, heightened suggestibility, and deep relaxation, similar to being engrossed in a great book or binge watching your favorite TV show. Contrary to what Hollywood may have us believe, it doesn't involve mind control, pocket watches, or making people cluck like chickens, unless you really want to, but that's a different story. Instead, it's a natural and altered state of consciousness that allows us to access the power of our subconscious mind. The history of hypnosis is just as intriguing as the state itself. And while it's often associated with the work of Franz Mesmer in the 18th century, who used animal magnetism to induce trance-like states, the roots of hypnosis trace back to ancient civilizations, including the Egyptians and the Greeks. And these ancient cultures recognized the therapeutic potential of altered states of consciousness for healing and personal transformation. Now, NLP is essentially a user manual for the brain. It's a method for understanding and improving the way we think, communicate, and behave. At its core, NLP recognizes that our thoughts, language, and actions are all interconnected. And by exploring and optimizing these connections, we can achieve profound and personal transformation. Now, NLP was developed in the early 1970s by Richard Bandler and John Grinder. They began by studying exceptional therapists like Fritz Perls, who was a Gestalt therapist, Virginia Satir, who was a family therapist, and Milton Erickson, who was a psychiatrist and hypnotist, and described by many as the grandfather of modern-day hypnosis. And that's where the link between NLP and hypnosis comes from. By modeling the language patterns and techniques of these experts, Bandler and Grinder formulated the foundational principles of NLP. NLP is predicated upon the belief that all behavior has a structure. It was created to develop new ways of understanding how verbal and non-verbal communication affects the human brain. NLP not only helps us to communicate better, but also learn how to gain control over the automatic functions of our own neurology. Hypnosis operates on several foundational principles. Hypnosis induces a trance state, characterized by heightened focus and suggestibility. As I mentioned earlier, it's kind of like being deeply absorbed in a captivating book or movie. In this state, we can access the subconscious mind, which is the storehouse of our beliefs, memories, and emotions. This allows us to explore and transform thought patterns and behaviors at a deeper level. Hypnosis typically involves deep relaxation, which is not only enjoyable, but also essential for reducing stress and enhancing overall mental well-being. While in the hypnotic state, individuals are highly receptive to suggestions. And these suggestions can be used for therapeutic purposes, such as overcoming phobias, managing pain, or improving self-esteem. NLP is built on several fundamental principles. The map is not the territory. And what we mean by this principle reminds us that our perception of reality is not the same as reality itself. Our mental representations or maps of the world influence our thoughts and behaviors. Building rapport or a deep connection with others is crucial for effective communication. Developing heightened sensory awareness allows us to pick up subtle cues in our environment and in others' behavior. NLP encourages us to define clear outcomes and goals, which helps us to focus our thoughts and actions on achieving them. And by recognizing that we have choices in how we respond to situations, we can adapt our behavior to achieve better outcomes. Now, hypnosis leverages the power of suggestion to positively affect our thoughts, feelings, and behaviors. It's like having a direct line to the control center of our mind. Now, during a hypnotherapy session, a trained hypnotherapist guides individuals into a relaxed state. And in this state, individuals become more receptive to positive suggestions. For example, if someone is struggling with a smoking addiction, a hypnotherapist might suggest that they no longer find smoking appealing. In a very simple sense, and over time, these suggestions can reshape our thought patterns and behaviors. Now, one common misconception about hypnosis is that it involves losing control. But in reality, individuals in a hypnotic state remain fully aware and in control of their actions. In fact, patients will often report that their awareness of their surroundings is increased and that they are more aware of what's happening around them, that they can hear everything and just have a greater sense of awareness. Another misconception is that not everyone can be hypnotized. Well, the truth is everyone is hypnotizable, but because everyone is suggestible. And if you weren't so, then you just couldn't learn. NLP provides us with the toolkit to understand and change our thought patterns, habits, and behaviors. And it operates on the principle that our experiences are constructed through subjective perception. And by altering our perception, we can change our responses. One technique is to recognize that we have 5 senses: the visual, auditory, kinesthetic, olfactory, and gustatory, through which we take information in from the external world. This information is internally processed to make sense of everything. We see pictures, we hear sound, and we have feelings on the inside. Now, we already know this, but by identifying and understanding how a person's reality is made, you can start to make adjustments to bring on positive feelings, such as making the picture bigger and brighter, or reducing negative feelings or memories by making the picture smaller and taking the color out. Another key technique in NLP is reframing, which involves changing the way we interpret events or situations. NLP also delves into language patterns, helping individuals communicate more effectively and influence others positively. Techniques such as anchoring can help individuals trigger specific emotional states or behaviors. And this can be particularly beneficial for managing stress or boosting self-confidence. By working with an NLP practitioner or through self-guided study, individuals can develop greater self-awareness, enhance their communication skills, and achieve personal and professional goals with greater ease. Now, hypnosis offers a wide range of benefits, making it a valuable tool for improving mental health and well-being. And this can be coupled with existing therapies and modalities. It can help very effectively with treating anxiety, depression, and panic attacks. Hypnosis induces a deep relaxation, helping reduce stress and anxiety levels. It can help individuals conquer phobias or irrational fears. It can promote better sleep patterns and alleviate insomnia. And it's a powerful tool for boosting self-esteem and self-confidence. Hypnosis has been shown to successfully support individuals in overcoming various addictions, including smoking and overeating. And it offers a pathway to personal growth and self-discovery, helping individuals unlock their potential. And for pain, there are many documented case reports of surgical and dental procedures being carried out, as well as taking women through childbirth using just the power of hypnosis. The data has shown that patients recover quicker and need less post-operative analgesia than others. NLP offers a plethora of benefits, making it a valuable tool for personal growth and self-improvement. Improved communication. NLP helps individuals become more effective communicators, enhancing their ability to connect with others and resolve conflicts. These techniques can enable individuals to help manage their emotions better, reducing stress and promoting emotional well-being. NLP provides strategies for breaking unwanted habits and adopting more positive behaviors. It encourages flexible thinking and problem solving, allowing individuals to approach colleagues with creativity and resilience. And by rewiring limiting beliefs and self-doubt, NLP can boost self-confidence and self-esteem. Now, to bring it all to life, let me share with you some real-world examples. Now, I've seen clients overcome crippling anxiety, conquer phobias, and even enhance their athletic performance with NLP and hypnosis. It's like their minds went from being old flip phones to the latest smartphones, being more flexible and capable of incredible things. Bob here is a 29-year-old gentleman who presents with a 10-year history of anxiety, depression, and panic attacks. His parents divorced when he was 10 years old, and he lived with his alcoholic mother and grew up without much support or direction. He had been seen numerous times by his own GP and mental health team, and despite trying almost every antidepressant tablet available, he continued to feel the symptoms of anxiety and depression. Although constantly having suicidal thoughts, he never made a plan to act out on these thoughts. He had counseling on several occasions and completed a course in CBT, cognitive behavioral therapy, but he found no benefit from these, unfortunately. But by using a combination of NLP techniques with hypnosis over just 2 sessions, we were able to significantly improve his feelings of anxiety and depression and almost completely eliminate his panic attacks. Over the subsequent months, he was able to come off his antidepressant medication and overall feel better and more positive than he had done in years. Another case here, Sally, a 59-year-old lady presenting with a 30-year history of migraines. Now, she would experience these at least 3-4 times a week, and they were exacerbated by heightened emotional states and sometimes lack of sleep due to stress. They would be so severe at times that she would have to take a few days off work each month. And when she was originally diagnosed, she'd been seen by the specialist, had an MRI scan, all of which were normal. And over the years, she'd seen several specialists who were unable to adequately treat her symptoms. She was put on increasing amounts of medication, including painkillers, but despite all of this, she would seldom find relief. And if she started to experience an episode, the medication wouldn't help. Sometimes she would persevere and get through the day, but sometimes she would need to lie down in a dark room and sleep for hours. She underwent a single session of hypnotherapy, during which time she was allowed to relax her mind and body. She was taught techniques of self-hypnosis, and she continued to use that to this day. And 4 years later, she, although has occasional mild headaches, she's not had one single migraine attack. Jake here was a veteran and witnessed some horrific things. Now, patients who present with symptoms of post-traumatic stress disorder, or even those with insomnia, often what happens is that they see large, sometimes vivid images in their mind. Now, if I came to your house and painted a picture on your wall with your worst nightmare of all the worst things that are going on in your life, would you leave it there? Would you stare at it every day? Now, what they say is that they don't know how to control them, but they've never been shown how to control these thoughts. And using NLP and hypnosis techniques, there is a way to teach them a strategy that's different to the one that they had before. So in conclusion, NLP identifies what needs to change, and hypnosis helps you to make those changes more effectively. It's like hitting the mental reset button without needing IT support. But here's the real magic. Hypnosis and NLP aren't just standalone tools. They can also team up with traditional medicine and treatments for even better results. You see, NLP and hypnosis can enhance the effectiveness of traditional medical treatments. They can help you manage anxiety before surgery, reduce the discomfort of medical procedures, or even improve your response to medications. It's like having an extra boost of mental resilience to complement your physical health journey. Hypnosis is a remarkable state of consciousness that grants us access to the untapped potential of our subconscious mind. It's a valuable complementary therapy for improving mental well-being, reducing stress, managing pain, and achieving personal transformation. By exploring the principles and applications of hypnosis, individuals can harness its power to enhance their lives and well-being. And NLP is a powerful framework for understanding and optimizing the mind. It offers practical techniques for improved communication, managing emotions, and achieving personal and professional goals. By exploring the principles and applications of NLP, individuals can embark on a journey of self-discovery and transformation. Thank you very much.
Okay. Thank you, Naveed. So we've just got a few questions. So lots of people get nervous when they hear the word hypnosis, especially clucking like a chicken. What would you say to someone who's worried about this, and how would you change your mind to try hypnosis?
So it's really interesting because there's a number of misconceptions that people have there. A few of them I've touched on already. And like I said, most of them come because of what's people's experience of what they see on TV or stage hypnosis shows. And one common one that they'll say to me is, will I pass out or will I be unconscious? Well, the truth is, if you're going to be following the suggestions and you're listening to the instructions, then no, you can't pass out and you're not going to be unconscious. In fact, people who are in the state of hypnosis or undergoing a therapy session, they're very much engaged in the process. And it's often a collaboration between the hypnotherapist and the client. You'll hear everything, you're fully aware of what's going on, but you just don't care. You trust the therapist that you're with, and you're just deeply, deeply relaxed. Another misconception is, what if I get stuck, or what if I don't wake up? Well, often I'll joke with them and I'll say, well, if you don't wake up, that's a completely different state. That's called death. and hypnosis is often maintained by the conversation that's carried out by the hypnotherapist. If there's a pause that's long enough, often what happens is people will just open their eyes and they'll just come back to normal again. So these are the common things that people will often ask.
Thank you. So you mentioned language patterns in NLP. So someone's asking, can you give us an example of a language pattern that you use?
So I'll give you a very, very simple example. And I appreciate that I can't see anyone's camera here, but I'm going to ask everyone a question. How many of you are in a position where you've taken blood from a patient, as maybe a phlebotomist or using a needle and syringe, taken blood from a patient? And how many of you have had blood taken from you before as a patient? Well, there's one phrase which most of you, if not, I would guarantee that almost every single one of you have heard or said in the past, is the word sharp scratch. Now, if you think about this phrase, sharp scratch, at a time when a person is just about to have a blood test, at a time when they've already got heightened anxiety, they're worried, they're nervous, and if you say the word sharp scratch or you hear the word sharp scratch, then instantly the thought that pops into the mind is that there's a painful procedure that's about to take place. What this person's about to do is going to hurt. And inevitably, 9 times out of 10, they will feel that discomfort or pain. Well, if you change the phrase and say something different, or even don't even mention the word sharp scratch, distract the patient, talk about something completely different, 9 times out of 10, that person won't even feel that needle going into the skin. And that procedure will go effortlessly, painlessly. And most of the time, patients will say to me, have you done it yet? And I'll often say, yeah, I kind of finished a couple of minutes ago. So that's just one simple example, very, very simple example of just changing the language, changing the words, and giving the patient a positive experience and outcome. So I've got another couple of questions that have come in. NLP and hypnosis, are they used together or separately? So like I mentioned at the beginning, NLP and hypnosis are 2 different treatments. They're taught separately, they've got different qualifications, and as far as the training is concerned, there's very little overlap, but there is a strong connection between them, and there are some therapists out there who are trained in both NLP and hypnosis. They're both incredibly effective, but in those people who are able to combine them, then people will often get an incredible result.